looking forward to seeing people in 3 sessions. They're going to be designed for people who know about music therapy and also people who don't know too much about music therapy. I'm sure that some of the attendees will be music therapists. Others will be people in related professions who use music and want to use music more. And so in these 3 sessions, I'm going to try to provide an overview of some work in various areas. I'm bringing to this my own perspective, which comes from about 40 years of music therapy work, clinical work, and as an educator. I've spent most of my career full-time in 2 different universities, but during the time that I've worked, I've also worked always with various people at varying ages and with varying kinds of problems, so that I've always kept my clinical skills also active. And I will bring that perspective to what we talk about. The first day will be about music therapy with children and in special education. And here we're talking about various learning problems that children have. And I will give an overview of some of these problems, and then how music therapy is used with them. We will, in each case, be emphasizing the clinical goals that music therapists work with. I will be showing some video examples. We will have discussion, including the experiences of those who are in attendance, and applications. We'll include clinical techniques such as improvising and recreating, both instrumental and vocal work, composing, and listening to music. The second day will be with emotional and associated physical neurological problems of adults and older adults. And this will focus on adults all the way up to older people with dementia or Alzheimer's, diagnoses also with of schizophrenia, depression, things like that. And also, I should say, trauma related, such as post-traumatic stress disorder. We, as in the previous session, will talk about some of these problems and the clinical needs of people with these problems. And then I will talk about some of what music therapists can do and illustrate this with some examples from videos. And as in the previous session and the following session, we'll be very interested in what the people in attendance bring as far as your experiences, your questions, your thoughts, and we'll see how it all develops based on who's in the group and how you want it to go. The third session will be music therapy in medical settings, including hospice and palliative care and physical rehabilitation. So medical settings is largely hospital work, all the way from the NICU or neonatal intensive care unit for babies who are born needing extra help, and all the way through to older adults and people not necessarily in hospitals, but in hospice and palliative care, people who are dying, and how music therapy is used to help in that process. A lot of my work that I will be talking about has been in hospitals, so that is one thing that I will bring some examples and my own experiences to. We will also talk about neurologic music therapy, which is a specific technique that has been, I should say, a specific method that has been developed for use largely with people with neurologic problems, physical rehabilitation, and I am trained as a neurologic therapist, so I can talk about that in some with some examples to you. Again, we will talk about various uses of music, including instrumental and vocal, improvising and recreating, composing and listening to music. And again, we will be interested in what those who are in the group bring as far as your own experiences, your own work, your questions, and how you would see music therapy developing in your own lives and your own work. Thank you. I'm looking forward to all of these sessions. Thank you.